I'd like to introduce you all to our speakers. Tony today will give a history of the Dorset Care Record and the current developments taking place, including my Dorset Care Record. Jodie will also give a live demonstration of how the Care Record and my Care Record works. Tony and Jodie, thank you so much for agreeing to speak at our event today. I'll just first of all pass over to yourself, Tony.
Thanks very much, Jim, and thank you also to Jill, and thanks so much to all of you for attending today. It's great to see so many faces, a number of whom are very familiar, and I wanted to thank those who have been involved in helping us with testing over the last year with myDCR, the patient portal, and obviously we'll touch on that in the presentation. I also wanted to think just to say it's rather appropriate today that we're speaking, because I don't know whether you're aware, but the Department of Health and Social Care today published its final report on Data Saves Lives, Reshaping Health and Social Care with Data. And in a ministerial forward, I noticed Secretary of State Sajid Javid has said, the report is backed by a series of concrete commitments, including investing in secure data environments to power life-saving research and treatments, using technology to allow staff to spend more quality time with patients, and wait for it, giving people better access to their own data through shared care records and the NHS app. So it seems rather appropriate to be kind of talking to you today when it's very much in the news. So I'm just going to ask Jim to go on to the next slide, please. Thank you. So today I'll be talking a little bit about the history of the Dorset Care Record and our partners, be touching on some of the benefits, including the financial figures, just let you into how we work in terms of the governance structure and where we fit within the new ICS. Talk a little bit about what's in the DCR, what's recently arrived, and what are we working on, and touch on the myDCR and some of the pilots that Jodie will then go through. Say a little bit about facts and stats in terms of figures for uptake. Talk about the training requirements for people, and have a quick chat about the comms and engagement as well. And then Jodie will give you a tour of the clinical side, the DCR in the test environment, and also talk about myDCR, the patient portal. So as Jim was saying, we're going to be kind of talking for about 35 minutes, and then we'll open up to questions. So let's get cracking. Next slide, please. So I just wanted to give you a little bit about shared care records. So every single ICS has to have a shared care record, and some are more mature than others. So Hampshire, in our neighbouring county, is the most mature of all the shared care records and has been going for about 20 years. And last month it achieved 200,000 record views, which was fantastic in a month. We've been going since March 2018, so we've been going for about 4 years since we first put some of the feeds in, our first demographic, and some of the summary care information from GP practices into the Dorset Care Record. And the aim of these shared care records is, as I'm sure you're aware, is to provide this electronic repository of to provide a consolidated view of information from right across our health and social care settings in Dorset. And that basically will enable details of a person's medical or care needs to be summarized in the same place. So when I first joined DCR, which is some time ago, I remember kind of speaking to clinicians at Bridport Hospital, and they were saying how difficult it often was to get information from the local GP practice. And that was mainly because everything was held by the practice manager, and the practice manager was on leave. Then she was the only one who had the information, and so they'd have to wait. They were told you'd have to wait until she gets back. When's she getting back? Oh, she's gone for a fortnight's leave. So often people were going out to see patients with really very little information. And so DCR, as hopefully I'll show, is making a real difference, or has made a real difference over the last few years. Next slide, please. So this is a slide that will hopefully, if the technology works, will show the kind of joined up nature of the Dorset Care Record. So it shows or it's meant to show, so keep on clicking, how the links between hospital and primary care. So the DCR involves hospitals, involves primary care, it involves community and mental health. We have been trying to work with the ambulance service. It's quite difficult for shared care records because obviously due to the privatized nature of shared care records, a lot of different counties have different systems. And so for a regional organisation, it's quite difficult, but we are continuing to talk with the South West Ambulance Service Trust. Then the social care and children's services, we're beginning, as I mentioned, to talk to hospice, and we've got some third sector partners who've just joined and out of ours too. And you'll see there also in terms of the links with the carer access and citizen access that we're now developing for a series of pilots with myDCR. So next slide, please. So just to run through who our key partners are, and then I'll talk a little bit about secondary and tertiary partners as well. So we have the acute hospitals. So we have the former Royal Bournemouth and Christchurch Hospitals and Poole Hospital, now known as University Hospitals Dorset, and Dorset County Hospital as our acute hospital partners. Then we have all 72 GP practices providing summary care information into the DCR. We have community and mental health information feeds from Dorset Healthcare University. And we have the two local authorities, so Dorset Council and BCP Council, providing at present adults information. Although we hope in due course that children's will come on board. And it's interesting today that the actual ministerial report does highlight the fact there's a real need for more children's details information to be shared. Next slide, please. So obviously with COVID, we have had a number of requests for additional organisations to have read-only access to the Dorset Care Record, and these are the two main ones during the COVID pandemic who joined the Care Record. So Dorset Local Pharmaceutical Committee, community pharmacies, they're particularly kind of interested in allergies and discharge medications from acute hospitals, and so they have access in terms of read-only, as does Yeovil Hospital. So Yeovil Hospital takes about 40% of North Dorset patients go to Yeovil rather than to Dorchester, and they found it quite useful as well. Next slide, please. We also have some tertiary partners, and these are organisations that have contractual obligations with one of the core partners. So some of these are more advanced than others. So some actually have licenses and are using the DCR now. So that involves Help and Care, Avon and Wiltshire Mental Health Partnership, who are doing some work for contracted to do work for DHC. Age UK, West Dorset and North Dorset. In fact, they just got their first license this morning. They do work for both BCP and DC. And then we're also in discussions with Wellmore Hospice, with Salisbury Hospital. So Salisbury Hospital will be kind of similar, and some of the patients from northeast of the county go into Salisbury. And then we also are chatting to some of the 2 or 3 of the Wiltshire GP surgeries that straddle the Dorset border. So I'm thinking particularly around the sort of Sixpenny, Hanley, Tollard Royal area of North Dorset. And then also Marie Curie, who do end-of-life care, and beginning to talk with care homes. So Hampshire has quite a good network of care homes through their CHI system, and we've started discussions with Care South. But as you'll understand, there are quite a few hurdles to pass for these organisations to be able to join the Dorset Care Record. So they need to have signed up to the Dorset Information Sharing Charter. If appropriate, they need to be CQC accredited. They need to have signed up to the Data Protection Security Toolkit. They need to get IG support from the Pan Dorset IG group. They need to have gone through our ISGR Implementation Strategy group. So quite a few hurdles. So it's not easy to become a partner, and that's for good reason in terms of confidentiality and security. Next slide, please. So just talk a little bit about the benefits, and this, I quite like this wheel, really. I call it the cheese benefits wheel, because it's quite useful in terms of showing at a glance the benefits for both clinicians and I think for patients. So from a clinician's perspective, what they really like is the continuity of care and the availability of the care record 24/7. So that obviously includes bank holidays and things like that. And they say, actually, it's really useful in terms of having improved safety and care through better and more informed decision making. And I think for patients, often it's the issue of not having to repeat their story all the time. So service users now don't have to repeat their story. And they're beginning to say, actually, we're getting a better experience, because more people involved in my care know exactly what medications I'm on. Next slide, please. So we've also been doing some benefits realization work, which we're quite proud of, because it's really quite difficult to actually work out the amount of savings that can be made. So right at the beginning, we identified some of the kind of types of benefits that are available, and they're still kind of key today. So things like time saving, paper and printing reduction, improved patient safety, improved care of patients, improved patient experience. Now, some are obviously easier than others to work out. So we've been kind of majoring in terms of cost savings for time and paper across all the partners so far. And these benefits are recorded and tracked in a benefits tracker, and they have to be smart, so specific, measurable, achievable, realistic, and timely. And in the year just gone, the 2021-2022 year, this equated to just over £2 million of savings across our partners. And we are expanding that, and that's been kind of tried and tested and gone through a whole kind of range of ICS groups and committees. So we're quite proud of that in terms of being able to show that it is actually, as well as kind of saving lives, it's actually producing some financial benefits too. Next slide, please. So just a little bit, without boring you to tears, on governance structure. So how do we fit in? So we have a PMO, program management office of about 8 or 9 people. So it ranges from training to comms and engagement to business support officers to business analysts to program managers to heads of service and up the chain. And we basically report on a weekly basis with our partners to a working group, and that in turn reports to a program board that meets on a monthly basis that includes all our partners, and also a implementation strategy group, which meets every sort of 2 months and looks at direction of travel in terms of what things we ought to be concentrating on, looks also at the benefits and benefits realization, looks at the data in terms of how many people are using it, etc., etc. And then we have SOC boards and comms engagement and training, and myDCR board, the patient board too. Just worth kind of mentioning here about the Wessex Care Records, I think, in terms of, so Wessex Care Records was one of the first local health and care record exemplar pilots set up by the government. The kind of key aim for, one of the key aims for them is basically to provide interoperability that brings together care records at grassroots. So the kind of key long-term aim is that if you were to go away on holiday in the Peak District and have an accident and need hospital treatment, then the GP in whether it's, I don't know, Bolsover, would be able to look at your record and say, okay, well, I can see you're allergic to aspirin, so I'm not going to give you that. We are still a little bit away from that, but we are making progress. And so the now that Hampshire, CHI, have the same tech provider, Orion Health, as we do, the interoperability is beginning to come, is beginning to go forward at pace. And we hope certainly by this time next year that we will be kind of fully interoperable. So that would mean that doctors in Portsmouth or Southampton or Fareham would be able to see the same sort of information on the Dorset Care Record as the doctors in Bridport and Sherborne and Bedminster and Ferndown. So that's really quite exciting in terms of moving forward. Next slide, please. So that kind of neat, so hopefully a neat segment in terms of what's in the DCR and what's coming and what's not in there at the moment. So Dorset County, so the acute hospitals have been leading the way in terms of this, and you can see that Dorset County Hospital has fulfilled all its kind of obligations, and in fact has added a number of additional feeds as well. Most recently, last week, 1,500 maternity e-docs into the Dorset Care Record. UHD have just got two of the kind of key components left, really. We are making good progress. Spring 22 is optimistic. Summer 22 is realistic. So we are now kind of well on our way in terms of getting pathology feeds in from UHD, and that would be really useful for clinicians in the west of the county to be able to see what's going on in the east of the county. With Dorset Healthcare, we are talking with them at the moment on alerts and referrals, and with Dorset Council, we are talking with them in terms of adults alerts. They're still somewhat further behind than we would have liked, and it's obviously been quite difficult to move forward. But we are making strides, and as you'll see in a minute, you'll be able to see the strides that we've made in terms of take up of the record and users as well. Next slide, please. So this is the most recent usage stats. And if you look at the kind of key graph in the top right-hand corner, you'll see that back in April 19, we were really kind of hardly motoring at all. We were really not in a particularly good place. Fast forward 3 years, or just over 3 years. So these are our latest figures for May 2022, it should say April versus April 2022 rather than March. So this last month we saw just shy of 78,000 patient records. It was up 13%. And when it says single SSO, and I should have mentioned this earlier in the previous slide, is single sign-on. So this means that clinicians, out of a touch of a button, can link straight from their system. So if it's Dorset Council and Adult Services, then go from Mosaic to the Dorset Care Record. If it's Dorset County Hospital, they can go from their digital patient record EPR straight into the DCR. If it's Dorset Healthcare, they can go from I don't know, from their Rio system, and it saves a lot of time, a lot of energy, and it's, as you can see, it's proving really popular in taking most of the daily user number logins. So 61,000 for single sign-on, 11,000 for portal logins. And we're talking there in terms of daily access of about 2,500 records being accessed on a daily basis. But you'll also see that radiology report, pathology reports in particular, have been growing strongly. Next slide, please. So who's using the DCR in terms of our kind of key partners? You'll see there that we have two targets really this year. What we set ourselves, to reach 100,000 records accessed by the end of the calendar year, and as you've just seen, we're up to about 78,000. We started at just under 60,000, so we are on track just about. And similarly, we've targeted 5,000 active users. We were at 3,000, just over 3,000. We're now at 4,200. So again, we're on target for that. So the most use of the care record is at our acutes and Dorset Healthcare. But there's a useful amount of usage also amongst the local authorities, as you can see. There isn't so much use at GP practices, and this has always been an issue that we've struggled with. Now, GPs, as I'm sure you're all aware, are very information rich, and they've always traditionally said that actually, what we need is social care feeds in, because that's what we're really missing. And so it's a slight chicken and egg scenario. But now that we are kind of working on adults alerts, I think what we're going to be planning to do for GP practices is to run a series of kind of refresher webinars for them to try and entice them to get that number up a little bit more. Next slide, please. So I just wanted to touch on mandatory training, because we often get kind of questions asked about what do people have to do. We used to have a sort of belt and braces approach to consent, and that basically meant that every time a patient was seen, they would need to be asked, "Are you happy for your record to be shared?" Now that proved obviously to be pretty unrealistic when people were coming into the acute hospitals to ED with unconscious. So we now have a sort of discussion to view approach. And I'll say a little bit more about that in a minute. But basically, it means that you have during the patient's journey, you have to ask them whether they're at some stage whether they're happy for their record to be shared. So the mandatory training is around information sharing and security. It has a little bit of the background, some of the background that I've just been feeding in, some of the discussion to view elements we've just touched upon. It also talks a little bit about sensitive records and when and if to break the seal. It also talks about opting out. So we do have about 2,500 patients in Dorset who have opted out. I was dealing with one at the end of last week who was concerned. They said they'd opted out in 2018, but somehow they were still getting information, or information was being shared. And I was saying, well, if you need to opt out of the Dorset Care Record, if you opt out of the Dorset Care Record, you also need to opt it out of your summary care record. Otherwise, some information will be shared, and that's something that some people are still a little bit unaware of. And then there's a little bit around appropriate use of the DCR, so that only people actually actively involved in the care of a patient should be looking at records. And then there's a short assessment to multiple choice, 5 questions that they have to get 100% on. So a lot of shared care records don't do this, but we think it's really important, and the Information Commissioner's Office have supported this and backed this. So we're very much keen to continue this. Next slide, please. So this is just to have when to have that discussion to view. Likely to be during routine appointments, when the patient has the opportunity to ask questions if they wish, rather than when the patient needs urgent care. And it's great to see all these questions coming in, and I'm sure we'll have time to answer them a little later. Next slide, please. And as part of the kind of information sharing, we do talk a little bit about the security of records. The fact that the privacy officer does have audit logs, so we can look at exactly when and who, or the privacy officer can look at when and where and how patient records have been looked at. And then there's a session management activity timeout. So the system is only available for 10 minutes, and then it times itself out for security reasons. Bit more in terms of privacy and opt-out, and there's password encryption for the portal login as well. Next slide, please. I just wanted to nearly finish my section, really, just to talk a little bit about public engagement. And some of you who know me hopefully know that I kind of do take this really seriously. And I think it was really nice at a recent webinar to be praised by the national head of shared care records to say, we wish other shared care records did as much engagement as you do. Of course, we can always do more, but so here are some of the things that we do. So we have, as I'm sure you're aware, a public website, Dorset Care Record website. We have a intranet as well for partners, for partner information. We have social media feeds, so you can find us on Twitter and LinkedIn. We also have a YouTube channel. We provide twice yearly stakeholder updates. So the last one went out a couple of months ago, and sort of touched on myDCR and the patient portals. And we have about sort of 10 pilots, which Jodie will say a little bit more about in terms of reaching out to patients. And these are being run in conjunction with our kind of core partners. We have a helpline, dedicated helpline, FAQs on our website. We've got it's probably 60 case studies now, which people find quite interesting and useful in terms of seeing the benefits of the DCR. And then we do try as much public engagement as we possibly can, and have a dedicated PMO support team to help with any kind of specific issues with feeds. Next slide, please. And I think this is our last one that I just wanted. So this was an illustration produced by someone at Dorset Council who does these, and I think he does it really well. And it shows how Dorset Care Record connects right across the health and social care fields. So you can see there with pharmacists, linking with social workers, with GP practices, with health and care professionals. You can see the acutes there, but also in terms of the patient portal. And one of the kind of key things that I'd like to kind of leave you with, and one of the key aims and why I'm still kind of passionate about the Dorset Care Record and myDCR, is that it really can empower people to look after their own health and social care. And my goodness, in this day and age, we do need it. I mean, we've seen today the national food strategy and the ongoing debate about obesity and about healthy eating and stuff like that. And I think, patient records do have the opportunity to really empower people to take much more control of their own health and social care, whether that's in terms of the form of wearing of apps or other issues, remains to be seen. But with COVID and with the NHS app kind of growing in strength, we are certainly moving down the digital age at pace. So that's as much as I wanted to say, and I'm going to pass you over now to Jodie, and I'm very happy to take questions at the end. Thank you.
Thank you, Tony. I will just go to share my screen. Hopefully everyone can see that now.
Yep.
Great. So I'm going to go through today the Dorset Care Record, which is the clinician side, and also how the Dorset Care Record links with myDCR Care Record, which is the patient side, and what a patient would see in myDCR Care Record. So this is our test system. So all of the patients I'll be looking at today are test patients, and all of the data contained within them is fictional. So this is the first screen that a clinician would get when they come into Dorset Care Record. They can use a number of different ways in which to search for a patient. The most effective is the NHS number, as obviously that's unique to yourself. But as you can see, you can also use first and last name, date of birth, gender, etc. So for this one, I'm just going to add an NHS number for our test patient. And this is our test patient, Trevor, who's got quite a lot of information on him. So this is what would come up for a clinician. So it gives you some basic information in the header, his NHS number, which GP he's linked to, address, and this is the summary area that would come up. So it gives you information around any appointments he's had or coming up, anything around any alerts, so things like child protection order, missing persons, so he had MRSA here, any allergies and adverse reactions, and then any referrals. So he was referred to endocrinology here, for example. So these are just kind of snapshots of the information that's available in the rest of the record. There's additional details. So in here, you've got more information around where his information's come from. You can have your next of kin listed under here. You can have just more information about the person in terms of addresses, contact details, etc. I won't touch on myDCR Care Record yet, but I'll just move through the information that we've got available. So something that we touched on lightly was the diabetes pathway. And under here, there's some documents pertaining to the diabetes pathway. One of the things that we can do within there is the foot assessment, which I think, yep, that's what this is. So this is kind of a form that clinicians can complete around what they would do in an appointment with a patient for their diabetic foot assessment. The same for clinical notes. Under here are clinical encounter forms. Again, these link to our diabetes pathway, so they are specific for patients with diabetes that are on that pathway. So this information isn't available for all patients at the moment. Next, so we have a variety of community information. So here we have Dorset Community. So this is the information that we get from Dorset Healthcare. And if I just show you in a summary view, so you get their encounters, if they've got any problems and issues. Again, you get allergies and adverse reactions, any medication. We also have in our test system information from Weldmar, and we also have information from Wessex Cancer Alliance. So these aren't things that are live within our main portal yet, but these are things that we're testing within our test environment, just to show you the different types of information that we're also looking to get into the DCR. Under correspondence, we get, as Tony said, a number of different types of correspondence from both Dorset County Hospital and University Hospitals Dorset. So a good example of this is a clinic letter, which they display in a viewer just like this. And this one obviously is all test information, but gives just shows and renders quite well in the portal. There is then some discussion to view, as Tony said, about the conversations with patients to make sure that they're happy for a clinician to access their information. It's all contained in here. And then primary care. So this is where the GP record would sit for a patient. So again, it comes up in a similar way to the community information, and you get the same sort of stuff come up in the summary view. So you get encounters, problems and issues, allergies, medication, and then you can delve a little bit deeper into all of those. So you can see medication they're on now, medication that they have been on. As you can see, as he's a test patient, he has a lot of medication listed against him. So if we go up to the tabs at the top, we've got problem list. There's no information in this one. Oh no, there is, sorry. So we have got some information around the fact that he's diabetic. That comes up in here. Again, allergies and adverse reactions. There's nothing in his patient task list, but medications viewer. So this is where a clinician would see any medication that a patient is on. And again, when the medication comes up, it also shows the allergies. And if I show you in here, so here is where a clinician would see the myDorset Care Record information for a patient. So the way in which a patient gains access to myDorset Care Record is that they get invited by their email address, and you have to be invited by a clinician, and at the moment be part of one of our specific pilots, which I'll touch on as I go through the demo of myDCR. There's so this is here. So as you can see, Trevor has already been invited, and I'll go into his myDorset Care Record in a minute. But there's a number of different areas that a clinician can see, but it's probably better if I go into myDorset Care Record and then can show you it from the other side. So this is what you would see as a patient as your welcome screen for myDCR. So you'll have received your email to invite you to join the portal. You can then set up an account with your own password, etc. And then if we just log in, and this is the front screen that you're greeted with when you first go into myDorset Care Record, is your appointments. So it would show you if you have any upcoming appointments at either of the hospitals. And so as you can see, we can't see any upcoming ones for Trevor, but you can see his previous appointments. If we then delve into my health record, so this is where we have the actual information. So the first area for myDCR is goals. It takes a little while to load because Trevor's got quite a lot on there. And this is one of the pilots that we're doing with both MND at UHD and with rheumatology at UHD. So for example, rheumatology at UHD wanted to add goals around getting a bit more exercise for people, and the goals would be specific for a patient. So they can be something that's agreed upon in appointments with both a patient and clinician. So for example, Trevor's got one here around alcohol reduction. He can add progress for any of them or all of them at once. So he can say how many drinks a day he's doing now, or for effective coping, whether he believes he's on track. And then if I just go to add a goal can be added from both a patient and a clinician. There's a number of specific ones that we have already automatically uploaded, but we can add a custom one, so you can basically have anything that you want, and then you can have measurements around those. Goals also closely link with actions, and actions can be created to attribute to a goal. Again, these are being looked at in the pilots with UHD rheumatology and UHD MND. So as you can see, there's a diabetes specific one here around checking feet daily, and you can add notes, and you can, so there you go, there's a comment that's been added around that one. And then if you go to add an action, you can see that you can relate to a goal. So this will bring up any of the goals that you've already got. You can add a status, and you can add review dates to keep those on track. Next area where there's patient and clinician participation is around shared files. So shared files is an area where patients can upload documents that they would want their clinician to see. So for example, a diabetes pilot is looking at people uploading photos of their feet. And also clinicians can upload documents which are then shared with a patient. So we're looking at doing that with certain types of forms that people need to complete before appointments. So that the clinician would upload a blank form, and then the patient would be able to complete that form, re-upload it to the shared files area. Documents is the area where you can get your documents, so letters, etc., that have been created by hospitals sent to you from into your myDCR. So if I go back into my Dorset Care Record, if I go into the summary, and I will go into one of the documents, I will just pick any of the outpatient letters. And up here in the outpatient letter, there's a My Dorset Care Record published status. So this will tell you whether this document has been published to the patient or not. So at the moment, it is a manual process that a clinician has to approve that the document that they're sharing with the patient is okay to be sent to the patient. So for example, it's not going to automatically send all of your letters directly from the hospital, because obviously there's concerns around if a letter is disclosing information that hasn't been discussed with a patient yet, such as a cancer diagnosis. We obviously wouldn't want a patient to be able to access that without having a discussion with their clinician. So that's why at the moment we've got it manually. We are working around getting that automated so that, for example, all outpatient from clinic letters, so if you've had a clinic appointment, you get the letter anyway, that could be automatically published because it's information that you receive when you leave the appointment in a draft form. You're just getting the final version. So if we go back into myDCR, as you can see, I'll just show you how they render. So this one was a PDF one, so it renders quite well within the portal. And you also got the functionality to be able to download that and save that to your own files. Another area is health library. So this is where, say, for example, obviously we've got diabetes here again, but if you've got a specific condition like diabetes, a number of documents can be uploaded that are specific to your condition. So you could have some leaflets and information that would help you manage your condition. Back to my health record. So then we go into my links. So this is an area where we link to a number of outside applications. Here we go. Yeah. So we link to our Dorset applications, the videos. We've got a number of key websites, which I will show you. So these have been suggested to us. So they might relate to our pilot. So we've got ones around motor neurone disease. We're also doing some work with cancer around the RMS, so the remote follow-up for patients that have been through their treatment for cancer and are now being monitored remotely. So that's why we've got a couple of cancer ones on there. We've also got a link to our DCR website, which you can just move through within the window. We've got some help and guidance information around who to call if you've got any issues, who to contact. Our privacy officer's email address is there. And then contact us. So if there's any issues with the record or any information you want to come back to us within the PMO. Another key area on the citizen portal is my support network. So this is your, otherwise known as your circle of care. So this is where, as a patient, you can upload people to your circle of care who can either have access to your information or you don't want to have access, but it's useful to know about them. So for example, this one here, he's uploaded his granddaughter, she's his carer, he's happy for her to share information, happy for information to be shared with her, sorry. But then there's also his sister who's a key holder, and if someone was to contact and ask, he would not want information to be shared to her. There's also the potential to become a patient representative. So for example, we've got someone on our pilot who is using myDCR to allow his daughter to have access to his My Dorset Care Record, but with her own account. So she logs in as herself, but she has access to her father's account. There's also, you can add information around the care team, so any clinicians or social workers or anybody that's involved in a patient's circle of care. The clinician themselves has to upload that they are part of the patient circle of care, and they need to have themselves as a member of a patient circle of care in order to receive notifications. So notifications will be received once someone has updated a goal or action or a new shared file has been uploaded. And then there's just some more basic information around personal details. So again, you can have your emergency contacts, so your next of kin would sit in there if you've got that, anything around your demographics. And then if I just go here to your profile, you're able to change your own password, to update your own email and add a mobile number. But one thing to note around that is that that mobile number does not update anywhere apart from within your myDCR. So it's not that this will then feed back to any of the source systems. It will only be updated here. And if there is any issues with any of the information that you see on your record, we do say to contact your GP if it's around demographics. And I think that's probably my whistle stop tour done. And I can hand over to any questions, please.